More than we did, and we got all the answers possible.
We go to the next question. Assisted zona hatching, should we keep doing it? A lot of biologists in the room. Who wants to answer? Among the panelists? Sonny.
Yes, I consider there is one indication still available today to do assisted hatching when we observe the sickness of zona pellucida. There is absolutely necessary to do it. However, there is no reason today for advancing female age to make systematically assisted hatching.
Do you have enough data and studies to show that fixed zona, if you do or do not do assisted zona hatching, will benefit, you'll benefit from zona hatching?
I think in the literature.
Sorry?
In the literature, there is a randomized study with and without assisted hatching. They demonstrate there is absolutely no benefit for all patients. However, for one indication I consider, for example, when we're doing PGD for genetic disease or for screening, we doing systematically assisted hatching before to aspirate 1 or 2 blastomeres, and there is absolutely no risk for embryo quality. So I think it's still a place for assisted hatching just for one indication, it's the zona pellucidae sickness.
Well, there are several methods to do this, and certainly some of them, the question of security is not yet tested.
That's correct. You are absolutely right. So, I mean, when we're using laser, yes, it's very safety technique to do assisted hatching. However, if never you're doing assisted hatching with thyroid aside, you have to be careful. It's because the pH of your thyroid aside about 2.6, and internal pH of your embryo about 7.2 points. So you have to be careful. And if you're doing this, you have to washing mostly to avoid all penetration of thyroid acid in your embryo.
So you fear the acid more than the stream of electrons of the laser?
I prefer the laser, yeah, absolutely.
You prefer the laser. Anyone who in the room is not doing zona hatching at all? Stop doing zona hatching.
Except the sickness of zona pellucida?
No, well, without except. Just who is not doing it at all? Who is doing assisted zona hatching at any time for any reason?
I think the question
No, somebody is asleep here. No, somebody is asleep. Anybody who is doing zona hatching, raise his hand. Anybody who is doing zona hatching. So sometimes, anytime, sometimes, there would be, sometimes zona hatching, there would be maybe 30%. So it means that all the rest are not doing zona hatching. All the rest, who is not doing zona hatching at all? Almost same number. Almost same number. Maybe the other expect. Ask the boss what to do.
We can organize a randomized prospective study.
Yeah, right. No, but I think some of the people are still doing it. Some of the people stopped doing it. I don't think we have enough data to show why we started and why we finished. And many have embarked on it, and many have bought lasers and beautiful machines, and many startups. Some of them still exist, but we still don't know whether we should keep on doing it or not. So that's the reason for the question. Panel, please.
Someone wants to say.
Yeah.
Yeah, pleasure to just make the comments on this. Assisted hatching will be really very beneficial for all the frozen cycle, which I think is the hardening, but play a role on the failed implantation. So I do all my frozen cycles with all the assisted hatching. But of course, I'm using the assisted hatching, but non-invasive. I'm doing just a thinning, just a 1/4 thinning. So that is not breaching the hole. We found that the pregnancy rate is so much higher.
What you're using, I didn't understand.
Thinning, just a partially thinnings of the
Okay,
zona.
thinning of the
without
zona.
breaching the hole. So I selectively do it before, but I'm doing now this year. We started to do all the frozen cycle, and we found the pregnancy rate is higher, and the miscarriage rate is lower. Used to be miscarriage rate is higher when I'm doing the breachings of the hole.
Spanner, should we keep on using assisted zona hatching?
I think in the older woman there is support for that from the literature, but beyond that I'm not sure.
Can I have your comment? What is your comments on the frozen cycle using all the assisted hatching?
I don't know the answer to that because I've not looked at the evidence with respect to the frozen cycle.
Any other comments?
It means that the question is less interesting than the other. Then let's go to the following one.